Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
And I'm Dr. Krishna.
As you're aware, Dr. Krishna's been on some of our videos before. He's one of our staff anesthetists at the hospital that we work at. And today, he's going to talk to us about a very common question that I've been getting in a lot of the comments. We've been answering. People are like, what's the difference between an epidural and a spinal anesthetic?
Thank you so much for answering this question for us. I'm sure you've realized that we have to do our own hair and makeup for this show, so sorry about that. But thank you very much.
I didn't realize. Sorry, guys.
Thank you for joining us and telling us the difference between a spinal and epidural anesthetic, because we got a bunch of questions about that from our previous video.
And we do have a video that you can watch up above.
Dude,
it's not.
Yeah, it may not show up there.
Because if it's not there, just search for the video about watching a spinal anesthetic.
We don't really know how to embed links like that, so it may or may not show up there. It may show up here, it may show up there, we don't know, but just Google it. It's up there.
All right, so spinal versus epidural.
Okay, so before I get into the differences, first let me tell you what the similarities are. So both a spinal and an epidural are injections of freezing medication that go into the lower back.
Yep.
They'll basically cause numbness, essentially from the belly level down to your feet. We do have the ability to do these at slightly different levels of the spine.
Okay.
And depending on the level, you'll get freezing at slightly different levels of your body. But for most people, it's going to basically cause numbness from the belly down to the feet. Now, the biggest difference between a spinal and an epidural, for all intents and purposes, is that an epidural is used to continuously deliver medication, whereas a spinal is a single dose of medication. So we give one dose of medication, the procedure is done, the medication lasts for a fixed amount of time, and then it wears off. Whereas with the epidural, what we do is we leave a little catheter there. It's a little soft, flexible, almost like a thread.
You know what would be so cool? If you had one of those catheters to show people.
I happen to have one right here.
No, you carry those around.
I carry them around just in case someone emergently needs an epidural.
That is dedication.
You know?
Because we're not good at editing, you're going to have to move forward.
Oh, okay, sure. So I'm going to show you what an epidural catheter looks like, just so you get a sense of the gauge of the wire and see how small it is. Are you able to?
Okay, so that stays inside of your back.
Yeah.
Forever?
So for as long as we need the medication to last. So probably the most common scenario where we're inserting an epidural is a labor epidural when when a woman's giving birth. So the reason we use an epidural in that scenario as opposed to a spinal is because we don't know how long they're going to be in labor. It could be 2 hours. It could be 8 hours.
You don't know.
It could be longer. Not to scare anyone.
Yes.
It could be longer.
Could be longer.
But epidurals actually help tolerating that time, to be honest.
Okay.
But basically, we leave this in there, and it's almost like an IV in the sense that we can continuously give the freezing medication, and it continuously runs until we don't need it anymore, and then we can take this out, and it stops.
Okay, so a spinal anesthetic or an epidural anesthetic are two types of regional anesthetic where rather than giving a general anesthetic, we anesthetize someone usually from about this level down so that surgical procedures or childbirth or different things can happen in the numbed area from about here down. It's a regional type of anesthetic. But we really, can we look at a picture just to see the real difference anatomically between where a spinal anesthetic goes and where an epidural anesthetic goes, and just talk about the gauge of the needle or the catheter, how big the thing is that we're putting in someone's back, okay? So let's look at a picture right here. You got a picture?
So we're going to look at a picture.
Yeah, so basically what we're looking at here is the spine, the lumbar spine, so the lower part of your spine, close to like the pelvic area. We're looking at it in cross section. So imagine looking at someone standing sideways and then kind of looking at the spine from the sideways. So what we're looking at here is a picture of an epidural needle that's going into the epidural space. The reason it's called an epidural is because basically you have your spinal cord and then there's a sac that surrounds the spinal cord. And the layer that's outside of that sac is called the epidural space. So what we're trying to do is we're trying to get this needle into that space, then we thread the catheter through the needle, leave the catheter there, and deliver them, and then the needle comes out. So people are able to lie on this, you're able to lie on this, and that's basically how the epidural works. And then we can continuously give medication like it's an IV through the catheter.
Okay, and now the spinal, where does that needle go when you do a spinal anesthetic? And is it the same needle?
So it's a different needle. The epidural needle is a larger gauge needle, meaning it's a thicker needle because we have to be able to thread the catheter through the needle, whereas the spinal, we just need to give the medication. So it's a really fine gauge needle. So a spinal needle basically is very similar to an acupuncture needle. It's like a pin almost. It's very, very small gauge. The epidural needle is bigger. It's more like an IV catheter kind of gauge. And that's because we have to be able to get the catheter in through that.
And the spinal needle, you advance a little bit farther through the next layer?
That's correct. So basically the difference is that the spinal, we go in a deeper layer, and that's called the spinal space, basically. And so if you're looking on this image, the needle tip is at, there's a white thick space there. That's the epidural space. One layer deeper than that thick gray kind of area is where the spinal space is. So you'd be going a little bit farther to get to the spinal space.
Okay.
Okay, that was very helpful. And a common question in a lot of the comments on the spinal video is, I had a spinal headache. Why did I get it? Or why did I get a headache after someone put a needle in my back? It seems kind of weird. Like, poke me in the back, I get a headache.
Right. Okay, so yeah, it's a bit confusing how that happens, but let me explain that.
All right.
Typically, the headache, it's called a dural puncture headache. Okay? So the dura is the layer that we have to cross when we're giving the spinal medication.
Okay.
We do not cross that layer intentionally when we're giving an epidural for epidural medication.
Okay.
The problem is what happens is inside that layer, there's fluid. That fluid surrounds your spinal cord, and then it also goes up and surrounds your brain. Your brain is bathing in this pool of fluid. When there's a puncture there, if it's larger, then fluid can leak out and your brain kind of sags down a little bit. And essentially,
it sounds like that would give you a headache.
It's a headache. It's for sure, having a dural puncture is a headache when you have an epidural.
Sure, okay. And to explain too, that we're talking about millimeters, so when people say, oh, well, you're not supposed to do it, then why did you do it? Just because of the nature of the anatomy, that it's very, very close, that sometimes it happens, just like things in other things in surgery.
So to explain a little bit of the what happens there, essentially it happens more common, it can happen with the spinal, but it's much more common with an epidural.
Okay.
The risk of it happening with an epidural is about 1 in 100 epidurals. So every 100 epidurals, one person will get a headache.
Yep.
With a spinal, it's much less common. It's about 1 in 300.
Okay.
Mainly because it's a smaller needle that you're using.
Yeah, so it's less likely. The other things are that if you're a young, like pregnant age group type of person having, like, you know, a young female typically, you're higher risk of having a headache if you get the dural puncture compared to someone who might be in the older category of people that also needs an epidural for some other reason.
Is it because they have more fluid, do you think?
That's part of it.
Yeah.
Yes.
As we age, I think we end up with less fluid.
So you've got the newborn baby and you're starting with a headache.
That's right.
Okay. Good. Now, the one thing I want to clarify, and correct me if I'm wrong, when we're talking about these spinals, when we talk about the spine, there's the bony spine, right? The spine and the spinal canal, and then there's the spinal cord, which is the neurologic section of the spine. And where you're administering these anesthetics is just below the cord, right? Where it breaks up into its nerve roots. Am I correct?
Yeah, so for a spinal anesthetic, there's only one level that we really go at, which is in the lumbar area, and that's below the level of the spinal cord.
So you're not getting a needle into your spinal cord.
That's correct.
Right, but an epidural can go higher, right? You try to stay below the breathing area, essentially, but...
That's correct. So if you're having surgery higher up, like in the upper part of your abdomen, even in if you're having like in your chest wall or your lung surgery, we can do epidurals in the thoracic part of your spine. So that's the higher up part of your spine.
Yep.
And that's to help numbness in this area here. So we can do that. But again, the needle is not going into the spine, the spinal cord. It's going outside, to space outside of the spinal cord.
Okay, so that's important. You're not going to get a needle into your spinal cord.
Yes.
Okay? And the spinal anesthetic is going to go into the spinal space, but below the spinal cord. With an epidural, which stays outside the spinal space, you might be at the level of the cord, but it's not at the cord, it's away from the cord, behind it.
That's an awesome summary. So both used for pain, epidural for longer pain relief, spinal is more of a one-shot deal. That's an awesome description. Any other questions, Paul?
Oh man, that was awesome. Thank you so much again for taking time out of your busy day to hang out with us and help answer these questions.
No problem. If you like this video, please like it, subscribe to our channel, and share your experience with either a spinal or an epidural.
And remember, you are in charge of your own health.
We'll see you next time.